This is chapter 13, and we're going to be talking about community risk assessment. In this chapter, the objectives are explain the reasons a community risk assessment is important to the process of establishing safety education priorities, identify the types of risks that could face a community, collect community demographic data given sources of relevant information, and prioritize identified community risks. So as a level 2 educator, you're going to be following the community risk reduction model. A lot of times you're going to see it just like we did in level 1, referred to as CRR model. There are some definitions that you want to remember. The first is risk. This is any factor, human or otherwise, that could lead to an emergency, negatively affect the people, places, and resources of that community. And then we've also got risk assessment. This is the identification of potential and likely risks within a particular community, including an assessment of the community's preparedness and ability to resist the impact of those risks. So once the most important community risks are identified and prioritized, strategies to mitigate the risks are developed. Most often, a combination of strategies leads to the most effective solution and desired outcome for the safety of the community. That's the biggest thing, is that when you're doing these community risk assessments and you're trying to figure out what strategies are going to work best, you're going to find, just as with anything, we are going to, for safety reasons, just one strategy isn't always necessarily the case that's going to work best. So you're going to want to find out what combination of strategies. Is it something that we need a message that we need to educate the public about? Is it something that needs to be put in place in homes? Is it something like an ordinance or a town law, like a policy that needs to be put in place? So you're going to have different strategies. And it might even be multiple messages across multiple age groups based on what that type of risk is. So the first thing we're going to do is we're going to be looking at data and trying to identify the community risks. And the first place we're going to look is within our own departments. So you're going to be looking at department data that identifies risks. So where does that data come from? For us, mostly in the fire service, we're going to be looking at NFIRS. This is the National Fire Incident Reporting System. I would remember this. Whenever we do our call reports, anything we do in the fire service is put into our reporting systems. No matter what program you use, it all gets turned into the same national reporting system. And so our call data, we can look back at and look at the types of calls we run, the risks that we run into for our specific community. And that can change year by year. That's the thing about data, is it can give us a lot of information. But it also is just only one piece. So we're going to talk about other places in just a minute. Another type of place that we could be looking is Public Safety Answering Point. This is PSAP. This is something that I'll say my community that is not the case. This is like a call center in some parts of the U.S. and in Canada that actually takes the calls. Not like the 911 center, but actually a call center that takes them. And so that would be another place that would identify risk and have department data. So for my community, that we're looking at NFIRS. Most likely in North Carolina, that's what everybody's going to be looking at. Some other things that we're going to be looking at is consistency of the data entry should be insisted upon. That takes training, quality assurance, and more training. I will say, when I took over public education years ago, I ran into this problem. It was very evident. I started, like I told y'all in the past, I started in the fire service in 2002. Within the next year, I started doing public education. And the following year, I was managing the program at my department. And then I went to my first NFA class in 2006, and I had homework. And I went to the chief going, okay, I need some data. And I couldn't find any because of the way our call reports had been put in. So it is very, very important that there's consistency in how your data is being put in. I found holes if we ran into calls that there were injuries. If we've been very lucky, as long as I have been in my district, when it comes to house fires, we have not, knock on wood, had a fatality as long as I've been in the department. But there are other types of injuries and calls we've run into. but I wasn't finding that information in that data. So there were inconsistencies. We weren't finding ignition points for some of the fires or what the suspected cause of the fire was. And so there were holes in when I was trying to find information of what type of educational programs we needed. I was having trouble getting that data. So it's one of those things that you may end up having to work with your department, work with administration to find out how are you going to be able to improve that data. And then you've got to train the people entering data. In my department, our officers are the only people that can enter call reports. Now, it may not be an officer that is doing the call log from the call and the narrative, but the person entering it into the system is an officer. And if there is a hole in the information, they'll contact whoever wrote the report to try to get more details now. But it takes training. That's the biggest thing, is you've got to train your people how to do it correctly. Another thing that you need to remember is that good information, especially in these assessments, is going to take years. A lot of times you want to have 3 to 5 years of data. And that allows us enough time to go back and look at the history for our area, for our district, and to look for trends. A couple years ago, I was working on a water safety program, building a water safety program for our local rescue squad that I was a member of. And I needed data on the number of drownings we were having at the lake. And that was our specific goal that year, was looking at drownings. And I needed data. And it was very interesting to pull data. We had 2 years that we had, pushing 10 or more drownings. And then if I went a little bit further back, it actually started sloping off. So we saw an increase as we got closer to our current year. So we got to see that trend as we got more years of data. So that's what's very helpful, especially when we are trying to validate and give those reasons on why our program is important. That data is going to really help us. Your data should include the following information. You should have incident dates and times, the frequency of occurrences reported as a percentage of total calls. If you're looking at kitchen fires, then look at the percentage of the calls you've run, or the percentage of house calls or the house fires that you've run. How many of them were kitchen fires? You can break it down into pieces. You can look at the total number of calls you run and then break it down from there. The incident types, the incident locations or geographical distribution. That is another data point to look at. And it is crazy. We're going to talk in a little bit about GIS and those maps and map locations, because sometimes just seeing it on paper, you do not see the correlation or that trend until you actually map it. That is one of those things that is amazing. Mapping house fires, mapping kitchen fires. You may see a trend in the map that you wouldn't see on paper. And you may see a particular part of the community is starting to see a huge occurrence in a particular type of incident. And that map is going to be helping you to identify that trend. You want to look at the causes of ignition of fires, heat sources, and areas of origin. Those in themselves can identify the risks and the population that we need to talk to. And then response times of all units. Sometimes we need to look specifically at those response times in that data, because that is going to help justify as well. The occupancy type. You want to look at, what type of occupancy is it? Is it a business? Is it a building? Is it multi-story? Is it multi-family? Is it single family? Is it 1-story, 2-story, 3-story? Basement, no basement? What are you looking for? The occupancy type. Mortality and morbidity rates. And this is where you could have fire and EMS related, because sometimes we may not see that data. Sometimes the calls come after the fact. You may have falls that we're looking at in the community. So looking at both fire and EMS related data. The financial impact or dollar loss to value. That's a huge one to look at, is the financial impact. Populations most experiencing specific types of incidences. Are we looking at, people that are under 18? Are we looking at 18 to 29-year-olds? Are we looking at 18 to 40-year-olds? Are we looking at seniors? Are we looking at a specific age group of the population? Is it just moms, like soccer moms? Are we having a high occurrence of, incidences leaving school outside of a facility, or sporting event or after school, and it's parents? Is it, what are the trend? And then incident trending. What can you see from that information? Another thing that we can use is the availability of GIS information. That's Geographic Information Systems, and work with your local GIS department in your county. I know that our Davidson County GIS department is fabulous. They can do some amazing things in their mapping, and so we have overlays. They've helped overlay our hydrants into our maps. They've overlaid, we can have them overlay anything that you have that geographical information in those data points. Like the latitude and longitude information. You could have addresses. So they could help do overlays. And so you could have them help map incidences or types of calls. And they can be color coded. They could be where you click different buttons and they show up on the map in layers. It could be by date ranges. That could in itself could be a trend. Is it particular times of the year? So you have months and they're their own overlays. Now, if you don't have a local GIS department, an alternative to this that I have used is actually in Google Maps. And you can actually use Google Maps to pin things. I've done that for smoke alarm canvassing and relating that to call types. So you can actually go in and do the pin work and do the overlays the same way. It is not as fancy and it's not as accurate as the GIS department would do, but in some cases that may help you if you're in a smaller community and don't have access to a GIS department. The next thing we're going to talk about is the types of risks. And so the first one that we're going to be looking at is human-created risks. These risks are resulting from unsafe or inappropriate human behaviors. So, for example, older adult falls, motor vehicle collisions. If you remember in level 1, if you were chapter 1 of the text, if you have your book with you, look at chapter 1 and it talks about types of incidences, and those are dealing with human behaviors. Drownings, bicycle accidents, things that are preventable. And most of the risks that are human created are very preventable. So educating the public in those behavior changes is one of the most important tools that we use as educators to reduce the occurrence and severity of these risks. So human created risks are the ones that are preventable. Important data for these human-created risks is also accessible from EMS data, hospital data, local health departments, the CDC. You could have data from your call center, like 911 center. I know that whenever I was doing the drownings, that's where I was getting some of my data was from the calls into the 911 center about possible drownings. And so that put me beyond just our local lake, but also into homes where they may have pools and ponds and things like that. So it wasn't just one location. It was all across, looking at all different types of locations. So think about your own community. Where would you look, or who would you contact for data on human-created risks? Think about who would be having that data. Do you have doctor's offices, EMS, hospital? Remember, the hospital doesn't have to be necessarily in your district to have information on your area. Now, when you are getting data, this is one thing to keep in mind, is that you do have to keep HIPAA laws in mind, because there is certain information that they cannot give out. But there are ways to ask the questions that you are not getting identifying information about people. You are just looking for specific numbers of types of injuries, specific numbers on types of calls. So you have to work with them to make sure that you can get certain data. And we don't need to know those identifiers about the specific people. The other type of risk that we're going to look at is naturally occurring risks. These are not necessarily preventable, but sometimes they're predictable. Some examples are severe weather. wildfires, heat waves, cold snaps, cold weather, hurricanes, flooding. There's all kinds out there. Blizzards. Think of the wintertime and blizzards lately. It's things that are going to affect this is where you live in the country, even live where you live in the state. Some areas are more prone to flooding. Some areas are more prone to those cold snaps. So you want to look at your community's past history for the selected risk to help anticipate and pre-plan for future citizen preparedness, resource allocation, and community outreach. Think about the hurricanes in general. We've had some major ones come through even this past year, and we had areas that we know flood, that we know are prone to flooding. So that would be something in your past history of areas to watch. So whenever we had Florence and Michael come through this year, we had areas in my community that those were the first places we checked, were because we know they were prone to flooding. So we were already in contact with some of those homeowners. We also had areas that were not typically prone to flooding that flooded during some of those. And so we were prepared from our past history, but we had plans in place that assisted us for those areas that were not. But these are a little more predictable. A lot of times these can vary by geography, topography, and weather typical for a particular region of the country. I mean, think about it. We've had small earthquakes in our area, but nothing like the earthquakes that happen like on the West Coast. So think about your community. What are naturally occurring risks unique to your community? Do you have an area that's prone to flooding? Are you more likely to have wildfires? Even think in North Carolina, there are areas that are more prone to wildfires than others. So think of those for your community. And what are some of those? Some other places to get some other weather-related risk information. You can look at the National Weather Service. You can look at the National Oceanic and Atmospheric Administration. A lot of people look at NOAA's website. And also the University of Colorado's Natural Hazards Center. So all of those are some great places to find out information about weather risks for your area. You also want to look at contributing factors and populations that are at high risk. Looking over level 1 and the beginning of level 2, we as educators know and should understand that there's a strong correlation between the characteristics of specific populations and their vulnerability to risk. Some of those are social factors, economic factors, and environmental factors, risk factors for specific populations, like our high-risk populations, and even growth trends. Social factors, and I would remember these. So there's 3 that we're getting ready to come up on that you need to remember what they are. Social factors, these are going to include cultural influences, healthcare, affordable housing, levels of education, values, beliefs, traditions, customs, peer and family influences, childcare arrangements, and availability of government assistance programs. Think about this. Cultural differences and influences can have a factor on what risks. Think about how people cook. And their cultural differences between those families and those communities and how they cook put some families more at risk. What they cook with, how they cook, what it looks like. The next is economic factors. These include local economy, employment levels, economy levels, single-parent families, and transportation to employment. So I would remember this one as well, economic factors. What roles these play in that community. There is a high correlation to socioeconomic status and your risk for fire and injury. Those that live at or below poverty level are more likely to run into some type of issue with a fire in their home. And some of that is the lack of smoke alarms. Some of that is just the lack of education. Sometimes sometimes they're not the ones that we do see in some of our programs. So think of those things. Environmental factors, I would remember this one also. These include housing conditions, substandard and older construction, multifamily housing conditions, hoarding, abandoned buildings, buildings in close proximity to one another, Exposure to nearby fires, grandfathered structures. So that means that things that they were grandfathered in and the coding, they may not be up to code. Poor local code enforcement. Buildings lacking fire protection systems, department response times. Remember, there's some areas that it may take the department longer to get to, or something may cut them off. Think about as simple as a train coming through may cut off a department's response time. And even difficult topography. I know that there are some areas in my district that some specific homes that because of the topography to get to those houses, we are almost cut off except for a brush truck getting back there. Most of the homes in some of the areas are large enough to be sprinklered. And some of that is the fact that it's hard for us to get to them. Next is risk factors for specific populations. Those most at risk are children 5 and younger, adults 65 and older, people challenged by cognitive, physical, mental, and emotional disabilities, those living in poverty, and non-English speaking populations in some communities. These are the high-risk populations that we talk about in Level 1. And we talk in detail about why these specific populations, but just keep in mind that these groups are at a higher risk. And then you've got growth trends. This, you're going to identify how local populations have changed in the past 10 to 20 years, and then project trends for the next 10 years. So where can you look for data on your population for trends in your community? Keep things in mind as there's some places you can look. If you're looking in groups of 10, that an easy place to start on growth trends for your community is the census website. Census happens every 10 years, and that is a way that we can look at data. We can look at the age ranges. We can look at how many members are in a household. We can look at, how much income households on average have. And we can look up by census tract and get it as close to our fire districts as possible. Another thing to look at when you're looking at these risks is identifying target hazards. I would remember that a target hazard is facilities in either public or private sector that provide essential products and services to the general public, and are otherwise necessary to preserve the welfare and quality of life in the community, or fulfill important public safety, emergency response, and or disaster recovery functions. So some examples of these target hazards are schools, hospitals, important government offices, your EOC, your Emergency Operations Center, your 911 Center. Those are all those facilities in the area that are essential products and services to the general public. The next thing you're going to want to do is you're going to want to build a demographic profile for your community. So you're going to want to take that information that you've gotten on some of your populations and those risks, and you want to create a profile. So the data can be sourced from American Fact Finder website at the U.S. Census Bureau. You can look at the American Community Survey and local Chamber of Commerce, among others. So an easy place is to start off on the Census Bureau website. And like I said earlier, you can look, it's just census.gov. You can go and look by census tract, and you can look at your area or even just specifically your city, and it'll break down the information for your community. Some things you want to make sure you include when you're building that profile are demographics, economic characteristics, and housing profiles. The demographics are the information about people. That includes the total community population, census tract population, age group breakdowns, gender, race, and ethnicity, education levels, and social and cultural attributes. You'll find all of that information on your census website. It'll even break down like the age ranges for you. And I can tell you from census data in my community, our population is just over about 4,200 people based on the last census. And we're an aging community. Majority, our population is mostly on the older side. And so that makes a difference on your outreach and what strategies you're going to use. The economic characteristics, the income levels and employment profiles. Included are the types of jobs, income level ranges, local unemployment rates, stability of employment rates, strength of local economy and major local employers. That's definitely where your local chamber of commerce can help you with some of that, especially those deployment information. You've got your housing profile, the average age of the homes and occupants, new or older construction, types of construction, and types of residential properties, percentage of renters versus owners. That makes a difference, especially when you're looking at some outreach programs. Especially think about neighborhood canvassing for smoke alarms. Are we renters versus homeowners? Remember that in North Carolina, there's a general statute that says that rental properties are required to have working smoke alarms, working being the key. If they don't have one, then the owner of that rental property is responsible for putting one in. So keep that in mind. And properties grandfathered and not meeting current safety codes. You want to prioritize the identified risks. So when building that prioritized model, you want to evaluate each of the identified risks based on the scales of the likelihood it's going to happen, from rare to almost certain. In our communities, there's topics that we want to talk about, but they may be on the likelihood they happen is on the rare side. Consequence and severity. Level of the impact to individual or community, this could range from minor impact to total devastation. Think about some of those risks, especially the ones that we don't have control over, like hurricanes, those natural disasters. What's the severity? If you live out on the coast in some communities, those natural disasters might be a higher priority for your community versus someone more inland like I am, where I live on the I-85 corridor. My district is on the I-85 corridor. We see hurricanes, but the severity is not as bad as in other communities. And then frequency. How often does the risk occur? When building your prioritized model, these are some more things. You want to think about the duration. Incidents lasting from less than 1 hour to longer lasting impacts of a year or more. Is there a risk that the incident that you're dealing with could last a while? Think about wildfires. Those could last for weeks or months. Capacity, the level of the emergency response to accommodate the demand for services, including hospital and mutual aid departments. You want to think about the political and economic influences. They may dictate the level of priority for a particular risk. So therefore, participation of stakeholders and community partners is invaluable in building the risk assessment profile and associated strategies. The political climate can make a difference on where a risk falls in the priority, especially if something's just happened. It may end up on a higher level of priority. For example, hurricanes. Right after a hurricane, that probably is going to end up being a higher priority to make sure you have programs in place. And then the last thing is applying the assessment for your community. In order to plan meaningful and beneficial strategies, the information should be shared with the administration in a readable, understandable, and thought-provoking format. Everyone must understand the value of using some type of systematic approach to moving forward with the strategies. So to wrap up this chapter, the Level 2 educator's role involves developing programs and strategies aimed at improving the safety of the community through educational efforts. A logical place to begin identifying community risk is to look at what the department experiences in terms of the types of incidences, call volume, location, and causes. All local target hazards should be identified and included as locations for consideration in a community risk assessment. Firefighters are in a unique position to understand identify the hazards within their response area and may already have detailed information about target hazards in their pre-planned surveys. It's imperative to take the time to work through a community's risk analysis so all planning and resulting work is aimed correctly at the community's essential safety requirements.